Hi, everybody. Go check out my friends at Sonic Science CBD. They're a full spectrum hemp based CBD manufacturer based out of Renton, Washington, that use the entire hemp plant to extract phytocannabinoid rich CBD oil in a pharmacist licensed clinical lab using medical grade CO2. CBD, for those of you who don't know, is a non intoxicating remedy for insomnia, anxiety, chronic pain, and other inflammatory conditions. Sonic Science makes a variety of products, including tinctures, topicals, pre workout, which is my personal favorite, along with flour. Go check out their Facebook group, Sonic Science CBD, to learn more. Also, check out episode 8 of the Roscoe's Wetsuit podcast, in which I interview Sonic Science CBD CEO and founder Tim McDougall. Welcome, everybody, to a new episode of the Roscoe's Wetsuit podcast. I am with a special guest tonight. I've got my good friend Nizar Taki. Dr. Taki, welcome to the show.
Thank you for having me, Toby. It's an honor.
Absolutely, man. Well, Nizar is a really interesting guy. We met at a place I used to work at and basically went through this week of brain training together and ended up just kind of, vibing out and started talking towards the end of the week, and just a lot about a lot of similar interests that we both have, and ended up kind of staying in touch. And I'm really happy I have you on the show tonight to talk about kind of a lot of your path as far as starting off. I want to start off with how you are a plastic surgeon by training. To start off, how did you get into that sort of work?
Thanks for asking. So I am trained as a facial plastic surgeon, and the path I took was kind of knowing in medical school that I wanted to do surgery of some kind. And then once you decide to be a surgeon, you have to choose kind of what part of the body you want to specialize in. And I always thought the face and the head and the neck were the most interesting. So I did a residency in Otolaryngology, which is surgery of the head and neck, or the ears, nose, and throat. And then after that, I did a subspecialty training in facial plastics. And the reason I chose plastic surgery is I've always been really interested in in what makes people tick, what makes people happy, how people's self-image works. And one of the books I read, I think it was around medical school when I read it, was a book written by a plastic surgeon in the 60s. And it was one of the first self-help books. And it was called Psycho-Cybernetics. And cybernetics is a word that refers to steering or like navigation. And it refers to how this plastic surgeon wrote about how people's self-image determines how they behave and basically the outcomes that they get in their lives. And he noticed this because most of the people that he operated on would, let's say, be really happy or confident after their surgical results. But he noticed that some patients, even if they had a really good surgical outcome, they would still be insecure, or they'd still have whatever problem it was that they hoped to solve with the surgery. And so he became really fascinated by this, and he realized that you can't fix somebody's self-image with surgery alone. It has to be, basically somebody's not going to become confident if they don't have the self-image of somebody who's confident. So surgery can sometimes change both, but sometimes it doesn't change the person's self-image, in which case then the surgical, they might have a great surgical result, but they won't feel like anything's actually changed. So I was really fascinated by that, and also really fascinated by people who seem to have everything that they need to be happy, like people who are healthy, who have money, and basically have, their whole life ahead of them, and then they feel like there's something missing. And sometimes it's, I wish I looked different. Sometimes it's, I wish I had more money, or relationships, whatever it may be. I was always fascinated by the people that seem to always want more, even though they have what most of us would consider to be lives that should make you really happy. And so I thought plastic surgery is a great field for exploring that, what makes people tick.
Right. So I'm curious, at what point, how old were you when you read that Psycho-Cybernetic book? Were you like midway through
Oh,
going through plastic surgery training?
this was before I started my surgical training. So this was like in after basically after college.
Okay. So I'm curious then, like once you actually like got through all of the training that you needed to do, did sort of that experience, did that like your experience with patients, did that sort of mirror what you had read about in the book? Is that
Yeah, absolutely. What I noticed was that most patients would have a change in their self-image after surgery. So like a girl might come in with, she's a high schooler, she's just graduating high school maybe, and she's really shy because maybe she like inherited her dad's nose, which just looks really big on her, and she's been insecure about that, for throughout high school. And then we do the surgery on her, and she comes back, and you can kind of see like she's acting differently, she's dressed differently. So I would see significant changes in people's self-image from surgeries. But then I also saw people who, and this is more rare, so I don't want you to think this is common, but people who had really great, great looking faces and great noses, and they would come in and say like, I'm really not happy with this. I want it to look slightly different, like 1 millimeter here, 1 millimeter there, and these people were really good looking, and you're like, they're clearly seeing something that's not there. And so I did confirm what Maxwell Maltz is the name of the surgeon that wrote that book, and it really did confirm what he said.
interesting? Yeah. Yeah, plastic surgery, that's got to be such an interesting field because it's like you probably see people who like I assume maybe like burn victims or like people who've gotten like serious kind of like facial accidents, right? Like people who noticeably have some kind of issue, but then like you're saying, there's people who come in and they have this kind of distorted body image and they're like seeing something that other people really aren't seeing with them, right? Is that you kind of have both ends of the spectrum there?
Yeah, so during my residency training, we saw a lot of, for example, kids with cleft palates, or yeah, people in accidents and whatnot. They need reconstruction, and those types of things have a definite impact on somebody's mental well-being. Like, if you're a kid with a cleft palate and a cleft lip, it does impact obviously how others perceive you, and even the ability of the mother to form a connection with the child. So those things are like, there's not really much of a question that those things are going to improve the person's life. But then when it comes to cosmetics, that's sort of the gray area, because the indication for surgery, meaning how do you decide to perform a cosmetic surgery on somebody, is basically if the patient asks for it. So if they come up to you and they say, I don't like my nose, and their nose looks normal, you could still you could still operate on them, because to them they perceive that there's a problem. Now obviously it's up to the surgeon to decide, like, you don't need this isn't going to help you. But that's why I kind of chose cosmetic surgery as my specialty, because I'm more interested in the gray area where, and then if they are having it done, how do we ensure the best outcome? How do we ensure that they do feel more confident afterwards and don't go back to their old ways of being insecure and caring what other people think about them?
Mm-hmm. Right. Do you think so? I mean, I'm assuming that you probably saw a lot of people who came in thinking that just by fixing their outer appearance, they're gonna feel so much different about themselves. Their life was gonna change. Um, was it a common experience that maybe that happened for a little while, but then they sort of realized that there were all of these sort of internal blockages?
I mean, fortunately, most patients are already confident and well adjusted before going into the surgery, and so it's not um, it's not usually a big issue. But there are patients who they and it's called body dysmorphic disorder, because what they do is they see some kind of a flaw, and it may be a flaw that's not even really there, but they're convinced that this thing is the cause of their negative emotions of not being good enough. Shame is usually what the emotion is that they're trying to fix, and usually it's caused by some kind of a past trauma, is what studies have found, and they end up having numerous surgeries because they think that fixing this, this lesion, whatever it is going to get rid of the shame. But in reality, it's the shame is actually at the level of your unconscious mind and your beliefs. And so no amount of surgery on your face or body is going to get rid of that. You have to actually go to the core of it and do psychological surgery, so to speak.
Right. I wonder if like just kind of society, just the way kind of the media portrays, a certain body type, a certain, image of people like that, that certainly seems like it would drive a lot of, people to, feel the need to be excessively skinny or, have a perfect nose or whatever it may be. But you're saying, so from kind of what you've researched, it seems like it like actually has more to do with like personal traumas that is kind of driving their insecurity rather than like what society is sort of saying.
When it comes to body dysmorphic disorder, which is when people are having basically like wanting surgery over and over, and they're obsessed with this flaw to the point where it's actually interfering with their lives, that is usually the result of some kind of a trauma in the past, like somebody was abusive to them in some way, and it may be anchored to a specific body part because the person called them out on that specific body part, or it may be chosen for some other reason. In terms of society in general, I think that does drive a sense of insecurity and anxiety about the way people look, because marketing and media are trying to get people to purchase things and to work hard and make money so that they can spend the money. And so it's in the media's interest to make you feel like happiness can be acquired through something outside of you. So buying something or looking a certain way or is going to make you happy. That's kind of what the media sort of tries to show. The rise of social media hasn't helped things because people are sharing the best photos that they can get of themselves in an attempt to get attention, basically, and that can provide a skewed image of what other people's lives are like. If you think, oh, everybody's living these amazing lives and posting all these pictures of them having fun and being happy, when in reality they're probably no happier than anybody else is, that can cause a sense of dissatisfaction. And a lot of people think that that's why there's been such a rise in an adolescent depression, anxiety, suicide rates. Seems to coincide with the advent of smartphones.
Interesting. Yeah. I mean, it's something I feel like as you said, like just social media is something where it's like you can choose to broadcast whatever you want to the world, and it's like a job interview where you sort of just inherently want to portray your best self, but it's like that's only a sliver. What you're seeing on social media, as you kind of alluded to, is like only a sliver of what that person is actually like going, experiencing in life, or how they look. They're especially models. They're sharing the top pictures that I'm sure are photoshopped and rebrushed and whatever it is, and then other people like then that sets like the standard where it's like other people feel the need to like, oh, this person's pretty, this person you know has whatever kind of material possessions like I want or whatever, and they look a certain way, so then I feel the need to like look like them, to try to get it. So it's interesting though, like how I wonder like how much of the media kind of drives the plastic surgery business. You think that's kind of like a big contributor to?
Good question. It it definitely, I mean, it definitely contributes. I mean, you see, even the types of surgeries that are asked for change over time based on what the media portrays as is good looking in the moment. Like you can look at what was considered to be like a desirable body type, for example, change over the decades, and even now is different than what it was, at the beginning of the 2000s. Even the types of, for example, one of my friends was just being interviewed for a procedure he does, eyebrow transplants, and he was pointing out how nowadays people want thicker eyebrows, and before people wanted thinner ones, and so people that overplucked their eyebrows are now coming in to get eyebrow transplants to make their eyebrows thicker. So what changes that? It's probably the media. I think what humans find attractive, there's a wide range. There's some things that are universal, but in terms of like specifically what people go for, yeah, it's kind of what's portrayed. And then I think people's comfort with it is growing a lot also because of the media, and it used to be more secretive that, if people got plastic surgery, but now for some people, it's almost like a badge of honor, and they'll document their journey through it. And they'll plan, their next procedure similar to like if you were planning a vacation.
Right. I think that's like a really good thing though, that sort of the shame, shaming people that get plastic surgery, that's kind of hopefully fading. I mean, it's like if people want to alter their bodies in whatever ways they want, and it's going to make them like feel better about themselves, like more power to them. Like I don't see any issue, even if maybe someone is sort of like approaching it with the wrong attitude, like I'm going to fix my body and then therefore I'm going to be happy, like, but still it's like I think it's completely their right to do whatever they want and modify themselves. I mean, but it also seems like it can sort of open up a can of worms, because it's like if you like alter your nose like a centimeter to the left or whatever, and you realize, oh wait, maybe I think it should be in this other position, like do you have like a lot of like repeat business where it's like people start and then just like can't stop?
Yeah, it goes back to the client that I'm talking about that has this perception that more surgery is better, or that surgery equals happiness, and it can be addictive because you are. And first of all, I agree with you. I think it's awesome, the technology we have and the ability to change the way people look, so that they can, so that they can choose that. And as long as the person, again, is not doing it to solve some other non-surgical problem, meaning great, and especially if they, you have to make sure you go to a surgeon that knows what they're doing. And there's some people that kind of that will go to surgeons, that may not be is fully qualified, and those people may end up with complications. In terms of repeat customers, it's mainly people that get sort of a high from doing it. Like if you were to have surgery on anything afterwards, you're going to get a lot of attention, like, oh, during your recovery, and people are going to, compliment them on their new face or nose or whatnot. And if those people start, think that, oh, wow, I really like this feeling, and then after a while it sort of fades away, like you get used to the way you look, you might think, oh, I could get that feeling again by having something else done. And, so you do see that.
Right. I kind of see, like, I'm starting to see a lot of parallels with like surgery and kind of like, or like plastic surgery and kind of like high fashion, where it's constantly dictated by like, what the magazines are saying, oh, it's the fall edition of, this GQ, and, then you got to change all your clothes for the winter. And it's just like a lot of marketing, and it's a lot like, okay, like I'm getting attention because I'm wearing this, $2,000 shirt, but then I can't wear that $2,000 shirt every day, or else people are going to get used to it. So then I got to like keep buying and buying and buying it. I mean, I don't know, I mean, I guess a lot of people are into it and it's cool, but at the same time, I guess you don't want to be a slave to like what other people think of you, I guess.
Yeah, absolutely. And good plastic surgery is surgery where people don't know that you had anything done. That's the important distinction to make, is unlike fashion where you're wearing, an outfit and somebody can be like, oh, wow, that's an amazing outfit. Who's the designer? If you're a good plastic surgeon, you don't have the benefit of your product marketing for you, because you don't necessarily want people to be like, oh, who did your facelift or who did your nose? You want it to look so natural that they don't know that you had anything done. So that's kind of the difference there.
That makes sense. Was there a specific time, like, was there a moment, or was it just kind of gradually over time where you kind of realized that people who are seeking this kind of external validation or trying to get their happiness, from changing their physical appearance, whereas it's kind of more effective to work on their inner selves? When, like, was that something like a gradual process, or was there like, did it click at some point?
That is a good question. I think it was maybe a series of realizations. Like the first realization was, not even related to plastic surgery, but I remember listening to Tony Robbins' Personal Power CDs in college. And I remember one of them, he talked about what does it mean to be successful? And he says there's people who are millionaires who are unhappy because they just consider themselves to be failures because they don't have more. And he said that to him, that was the worst kind of failure, to have worked so hard to get something and then still be unhappy. To him is failure. And so I started realizing that, when we're working towards something or wanting something, we need to be in control of our happiness, because how do we know that getting that thing is going to make us happy? And I didn't want myself and my friends, who were all very hard workers, I didn't want people to work their whole lives to try to get something and then end up being unhappy anyway. Then I started making the connection between that and plastic surgery. You'd see the opposite too. You'd see people that would basically have let's say a little bit of filler put in their face, and you or my eye might not even look different to us, but then when they look in the mirror, like, oh wow, like this looks so much better, thank you so much. And then you start realizing, how much of it is sort of in the mind, and that's when I started making that connection.
Mm-hmm. Right. It reminds me of this kind of concept of like the set point of happiness. I'm sure you may have heard of that. Like it's sort of a psychology concept where, you could take people, I mean, they've looked at people who like, are just normal average people and then they win the lottery and then it's like, okay, they're riding around in Lamborghinis and jet skis and like doing all this really cool stuff and like having a ton of fun. So yeah, like makes sense that their happiness is going to like raise up. But that happiness, it's like then once they get used to living a life of the jet skis and Lamborghinis, that becomes normal. So that becomes like it almost is like changes where like there's a bar, kind of like an imaginary bar that sort of gets set, and what could have what I feel like what could make like one person happy, say someone is riding around in like an old beat up 1990 Ford sedan, whatever, uh brand new like Honda Civic, they'd probably be thrilled with. But you take someone who's like riding around in whatever it is, like a Ferrari, and they're gonna think that car is a piece of crap. Like it's all about like your perception, and if you're used to like having nice things and then you don't, then it's gonna be like a huge drop off. Whereas like if you're used to not like having a ton of material possessions, then you get stuff, it's gonna be like it's just like all like as you're kind of saying, it's all about just your personal perception. Like it's not like the car or like your face or whatever it is. It's not like it has like any inherent like uh worth necessarily. It's like all about your perception of it.
Exactly. And so the phenomenon you're talking about, and I know exactly the studies that you're referring to, it's called, well, one of the concepts is hedonic adaptation or the hedonic treadmill, which is basically saying that humans adjust their happiness to get used to whatever improvements are made. And an example is like the world that we live in today has an abundance of wealth and resources, lives than we did back when we were, farmers. But there's not necessarily any evidence that we're happier as humans, even with all these things. And with the happiness set point, that to me is really interesting, because if I were just to tell somebody, hey, let's say you won the lottery, how happy would you be? They would predict that they would be very happy and that they would be happy for a very long time. Same thing if I asked you, how would you feel if you got in a car accident and was paralyzed? You would predict that your happiness level would drop and it would stay low for the rest of your life, or for at least for a really long time. But these studies have shown that that's not what happens. It takes a varying amount of time, but more on the order of months, you actually go back to your normal level of happiness, whether it's something really good or something that's really bad. So does that mean that we shouldn't strive for making our lives better? I think that what it means to me, and what I've realized and what I try to teach people when I coach them, is that your happiness is determined by your thought, by your thinking, which is malleable. And so if you be happier after they won the lottery, but their thinking is malleable, so they could go back to their previous happiness level very quickly, because it's not actually the money that's making them happy, it's the way that they think around the money. Same for having a catastrophe happen. So my question, or what I'm trying to explore is, well, like, let's stop trying to worry so much about the external circumstance, but how can we raise our happiness set point, so that you're always instead of, trying to like go up and stay up here and then your happiness set point is still down here, how can we make it so that you're permanently up here? And that's kind of like what I'm interested in.
Right. I just back related to what you're talking about. I mean, about that kind of hedonistic set point. Like, I feel like it's almost like if someone was to win the lottery, like there'd be, someone could go and just, go to some clubs in Miami, buy some, $5,000 tables, and hey, look at me, like like just super, like just kind of blowing money like that. But I bet you there'd be someone, if the money was in the right hands, someone who like won the lottery and would like start, like setting up a program to like feed the homeless, or like doing something that may actually like it. That's what I feel like about money in general, where like I think a lot of people who don't have money have the perception like, oh, money's the root of all evil, and like, you know, people who have money are inherently like selfish and greedy. But it's like, no, it's like maybe some of them are, but it's like actually how you spend the money. Like what I would do if I got rich would be a lot different than what someone else would do.
Right,
So
right.
that I almost wonder if they take into account when they're looking at that sort of like, there's another sort of like study about like, if you, I think it's like, if you make your happiness raises like pretty linearly up until you make, I think it was like $75,000 a year, and then it basically plateaus. So it's kind of saying like, you kind of you become happier with like all of, as long as all your basic needs are covered. You're not having to worry about your next paycheck coming in, to pay rent or whatever. You kind of got all the bases covered, and then it kind of plateaus. But I mean, I wonder, it's like if you make a lot more money and then you're actually using that money to fuel your own happiness, like how that, I wonder if they took into account, just personal variation in how people would spend that money.
Good question. And you're right. What they did find is that your happiness does raise when, if you have less money than you need, let's say to survive or to lead, to have all the basics. But as soon as you have enough, it doesn't really, having more money doesn't necessarily make you any happier. So basically what that shows is like, this is kind of just, a theory of mine, and I'm sure other people have thought the same, but like, what are your emotions for? Well, they're to help us survive. They're to help, an animal that sees a snake is going to feel afraid and run away, and then the fear goes away. You know, anger, would be a response to, a situation where you need to be aggressive, things like that. Sadness, when something, sad happens. And if they're a response to something in the environment, then they're healthy. Like, it's normal for those emotions to be there. Sorry, what I mean by that is if you are struggling to survive, then your emotions are being dictated sort of by the moment to moment, trying to make it, and so you're not really necessarily worried about being happy. You're more worried about, I want to survive. I want to have security. I want to have the basics. But we run into problems once all our basic survival needs are met. Then, well, we have everything that a human needs to survive, but we don't. But there's still something missing. There's still some sort of need to have a purpose, and we still have. So we feel stressed, even though there's really nothing there that's threatening us, and we feel anxious about some vague, thing like the future. And so it's like those emotions that were helping us before to survive now sort of aren't being regulated because they're being just created by our thoughts. And that seems to happen like once all your basics are taken care of, that's when you really need to start managing your own happiness from the inside, because at that point it's really, you can become as stressed and anxious as you want. There's plenty of things in the world to worry about and be stressed about. So you can still be very stressed and anxious even if you have everything you need to survive.
Right. And it seems like something that our brains are kind of like evolutionarily hardwired to like we always kind of are going to be more basically. So a couple podcasts ago, I had a buddy on who kind of explained this concept of loss aversion. Basically, it's a kind of a poker concept of how kind of losing resources is going to be more kind of harmful. Like, evolutionarily speaking, losing is going to be a lot more harmful than winning. So like losing resources is going to create a lot more kind of emotional suffering than gaining resources is going to create like positive emotions. So, but then at the same time, it's like we're in charge of our own mind, and it's like we can sort of go in and rewire that. I think that's a lot of what, kind of your work and sort of, neuroscience and meditation and personal growth, and the kind of fusion of all those things are kind of trying to figure out is like how can we take our brains, like with the current state of like we don't have to, like most of us aren't having to like figure out how to survive like on a day-to-day, we're not fighting for our survival, but we're still, as you mentioned, we're still kind of plagued by all of those same, worrying about what's going to happen, worrying about the past, worrying about the future, all of these things that aren't necessarily like adaptive anymore, but they're still sort of like wired into us, I think, on a core level.
Yeah, I yeah, I know that the loss aversion is an interesting thing. It seems to be it does feel like it's built in. Like you would rather not win, or sorry, what is it? You would rather lose five
I'm gonna pull up the exact
$5,000 than like lose $5,000. I forget how to word it, but the idea of having something and losing it is much worse to us than just not getting it to begin with. But I also wonder how much of it is hardwired and how much of it is learned. I think there's got to be some element of it being hardwired because of the way we respond to the environment and our need to survive. But then kind of like we were talking about before, there comes a point where you sort of switch over to your survival is already assured, but you still focus on negative things more than you focus on the positive things. And I think a lot of that is actually society definitely puts an emphasis on focusing on the negative, like that, be careful, bad things are going to happen to you if you don't plan. And a lot of it might be from parents instilling this in us when we were kids, and it might be something that we learn in school too. And certainly the media takes things that are, minor things and makes them sound really negative to get more attention, to get more eyeballs on the news. So we sort of live in a society that sort of teaches us that it's okay to focus on negative things and to complain about things that aren't really that bad.
Oh, absolutely. And it's like, I mean, I'm sure you have this experience where it's like you go out to just like any restaurant or you go out anywhere where people are walking and you just overhear people's conversations. It's almost always they're complaining about what some politician did. They're complaining about what their boss did. They're complaining about what their parents said. Like I just find that almost all people are like in this sort of like victim mentality where they're like, they think that their life is like, that their life kind of sucks. I mean, whether it sucks or not, but they think that, their life is like heavily affected by what someone else is doing, where it's like, I think me and you have come to the realization that it's like, more so about like what, how we're actually perceiving like that sort of situation. Like, because other people are going to do whatever the hell they're going to do. We don't have a lot of control over that.
Yeah. Yeah. And so I think a lot of it is learned, and then obviously what you do frequently strengthens the neural connections in your brain. So, it becomes hardwired, but I think it is flexible.
Absolutely. So I'm curious, like, because it seems like this is something, I mean, we've had past conversations and it sounds like this is, you've for a long time kind of been into this whole, personal growth, kind of developing yourself sort of sphere. Um, when did it sort of become an idea for you to actually take this and kind of turn it into a business? Like when did you think I want to be a personal coach and share my wisdom with other people?
Mainly, I knew that I wanted to incorporate an element of coaching in anything that I did. You know, like even as a plastic surgeon, I wanted to have that to be a part of the experience. But then when I met the person who's my coach now, he was somebody that had, you know, built his own coaching practice, and he sort of started telling me about the practicalities of it, like how you actually do it. And that actually really helped demystify the whole thing and made me realize, hey, I can do this. The other part of it was I started realizing that I actually, when I talk to people, they would be like, whoa, this is really interesting what you have to say. And I found that I had ideas that I think a lot of people hadn't really heard and that they really would benefit from hearing. And the more I kind of told people about, you know, my concepts, the more I realized that hey, I have something here that can actually help a lot of people. And so basically, it's like I'm very confident in my ability to help people, and so that makes it easier to set off on doing it professionally. And you're like, I'm really good at this. And then of course, and then the other part of it is having the know-how of, well, how do I like get this product out there? And that's the nice thing about having friends who are coaches and knowing people who are coaches, because they can guide me on that.
Right. I mean, that seems like such an important thing. Just like, did you have someone like that? Like when you were kind of, whether it was like a mentor going through, going through plastic surgery training, or like, what, like, did you feel like there was someone that kind of like instilled into you these sort of lessons, or did you more so like personally cultivate it through your reading and research? Like, how did that kind of come about?
You mean the coaching
Well,
relate?
just like your whole, I mean, like because you've gotten this feedback, right, from people, like like
Mm,
you tell people your theories, you tell them, about certain concepts you have, and it's like you're getting all this positive feedback, and therefore kind of becoming more and more confident in your abilities. But I'm guessing, what do you think was kind of the driver, like for you? Was it having a coach, or was it more so a solo kind of route?
I don't think I had. I got my coach recently, but it's been sort of a lifelong trajectory, and I think it's been, there are certain people who I've known, like friends of mine, who were also really interested in self-improvement and personal development, and so they'd share books that they read with me, and I'd share stuff that I read with them, and we talk about concepts. And then, but then at some point, what happens is, and I think this probably will happen to most people who start, you know, looking into it, is like when you start learning about the self, or, you know, the mind, it really is the most interesting subject in the world, because that's who you are. Like you're learning about what you are, and, you know, what reality is. And once I started going down that rabbit hole, it was just kind of a self perpetuating process where I just couldn't stop. I was like, I just need to learn more, and I want to figure out what's going on. I just want to figure it out. And so to this day, it's external motivation or mentor or anything. It's more like my own personal desire to know what's going on and to connect the dots. And yeah, like once you pass a certain threshold where you start seeing kind of how little we actually know of how our experience is created, you're like, wait, there's a lot of mystery here, and it's like I just want to know more. And so that's kind of ended up being me pursuing all these different threads on my own.
Hmm. Right. Just having that personal kind of passion for figuring all this stuff out. Yeah, that makes sense. And I mean, it seems like you probably find a lot of kind of like-minded sort of journeyers, um, who are also just as curious as you are. Um, but yeah, it's interesting. I mean, just that a lot of this stuff is stuff you kind of have to do kind of on your own time. Like it's not built into schools. It's not like we don't have dialogues about this. Like, you know, most people don't talk about this sort of stuff with their friends unless they have, friends who are coaches. Um, I think it's oftentimes sort of like I don't know, it's like what you're doing like externally, it's like people will talk about that a ton, but then when it comes to like the internal, like what is reality, or what's going on in my mind, like that's kind of a subject that seems like a lot more like off limits for like certain people.
Yeah, I mean, this that kind of thing is sort of, I think for a lot of people, it's like you're either maybe you have a religion that sort of answers those questions and doesn't really make room for asking more questions. In other words, a religion might say, these are the answers, don't question them. But then there's people who also aren't religious, but they kind of adopt the same attitude of like, well, if science hasn't figured it out yet, then you know, then that's it, then, or whatever science says is what reality is. And these people, it's like it's almost like being religious because they actually don't see how little science has explained, and so they think that, oh yeah, science has got it, like science has figured it out, but science has figured out very little of, or has been able to explain very little of how reality works. So it's like this false sense of like, yeah, we know what's going on, but it's like, no, we don't. And I'm not saying that you should just start making theories or pretend that there's like uh, you know you know high supernatural forces. You don't have to pretend that they're there, but you can't also just assume that we've got it figured out, because we definitely do not.
Right. Yeah, I think that's definitely clear to say. I'm curious, as far as you went to London, right, a couple weeks ago, and kind of met, if I believe, or if I understood it correctly, you were kind of meeting up with sort of other coaches, kind of a crew that was getting mentored by a certain coach. Is that is that accurate?
It was 13 men, and some of them were coaches, some of them not, and it was, you could call it an immersion or a retreat that was put on by my coach. And
Yeah. Yeah,
what
no,
he
I
does.
know. Sorry to interrupt you. I just was gonna say, like, I know you do a lot of these, and I'm just curious as far as like what your kind of the biggest takeaways, what you sort of get out of these events.
Events like that one, and even the one where you and I met, they serve several purposes. I mean, one is it's great to have a period of time where you just turn off your phone and just sort of stop doing the daily things that you do and just slow down your mind. Like that alone is very helpful and provides a lot of benefit. Um, what was great about that the other and other events like it is you the cool thing about it is you also see other people going through, let's say, their own transformation and solving their own problems, and you hear somebody with an issue that may not, that at first doesn't sound related to yours, but then you realize, oh, their problem is very similar to mine, even though they look different on the outside. The core cause or the core way of thinking that's causing it is the same, let's say, as I can apply it to my own life. So it's great to see other people fixing unrelated issues, because it actually helps you with your own issues, And for me as a coach, then I can see what worked for this person, so that then the next time I run into somebody and they say, oh, I've got this problem, I'll say, oh, and I'll have a new way of looking at it that can help them because I've seen it work in somebody else. Also, you can go deeper when it's like several days of focused work on yourself. Like you sometimes fix an issue, and then the underlying it is something else, and then underlying that is something else, and I mean there's no end to how much you can streamline or improve yourself.
Right. I just made the connection where it's almost sort of a solution in a way to the problem that social media creates, where social media is like what we were talking about earlier, is portraying people's best selves, not showing any of their problems. But like by going to one of these, groups, one of these workshops where you're actually like sharing and like learning, oh, like this person. So for me, I've, done a couple of these sort of things, and just have the biggest like aha moments of like, at first like looking at these people and I see them like so externally successful, and I'm just like, I sort of automatically assume all of these things about them, and that they must be incredibly like charismatic, confident people. But then they start revealing like a lot of their insecurities and flaws, and it's like sort of humanizing because you realize like they're kind of just like you know, they're not perfect, and they're not like they're letting down the mask that is like pretending to portray a certain idealized image.
Absolutely.
Yeah. I always feel just like having these conversations, I mean, that's almost like part of the goal of the podcast, is just like to break that, like having these like organic conversations, because I don't know about you, but I always feel like so much more refreshed after one of these, because it's like we go about our daily lives and there's so much just we have to act a certain way, because we want other people to perceive us, in a certain way, whether that's our bosses, our friends, our family. There's a lot of times where it's not really okay to just be you.
Yeah, I was thinking about this earlier, how like every 24-hour period we sleep for some period of time, 6 hours, 8 hours, however much sleep you get. But if you go without that sleep, then like you get progressively more detached from reality, and you start hallucinating, and you die eventually if you don't sleep. But when you do sleep, like it doesn't matter like what was going on the day before. Like you wake up and you're just like totally refreshed and ready to take on the day, and like you're very creative in the morning, and the problems from yesterday are only carried forward into today if you consciously kind of bring them back. But like even a nap can make you go from being in a really bad mood to being back to normal. And I feel like these kind of retreats, I'm realizing they sort of serve the same function on like a larger scale, where it's like, okay, I spend most of the year with my phone on me, responding to things, hustling as it were. But then this is like a block of time where like my brain is purposely going to slow down. And then when you go back to real life, your brain is still operating on that slower, in that slower mode. But of course it starts speeding up again, and you go back the way you were. And so then you go back to another one, And so my coach does these every 6 months, and there's people that have gone to like 8 or 10, and it's not like that they're not working and they keep coming back because the coaching isn't working. They're coming back because it provides a tangible benefit that occurs, and and it's like to refresh yourself every so often.
Yeah. I mean, it seems like something that's neat. It's almost like a mental vacation, right? Do you come back from these like, I mean, I assume kind of like with a lot of different perspectives, and Is that something you think is like a big part of just your trajectory in terms of growing whatever it is I mean, if it was before kind of doing your plastic surgery business, um, or just getting ideas, is that kind of a big part of it? A big part of you feel like just being able to be creative, stepping out from your day-to-day life?
Yeah. Yeah. Um, for me, yeah. And I think other, very successful people and creatives and etc. do the same thing. There's a really good book called Deep Work by Cal Newport, and he starts the book by saying how Carl Jung, the psychologist, had a retreat, like this like stone house that was built by hand with no electricity, and I forgot where it was, somewhere in Europe, like in a forest by a lake, and he would go there for half the year. So half the year he'd be a practicing clinician, a psychologist, and the other half of the year he'd go to this retreat and just write. And Cal Newport says that we all need to have this kind of like time where we can just be alone with our thoughts and our work to allow our brains to process it and create. And whether you do that like half and half, or like every week you have a block of time, I think that if we just stay in the rat race, or doing your job, like working for somebody else and not taking time to yourself, I mean, you can do that, but true growth, I think, happens in the times when you're away from that. Kind of like when you're working out, the muscles actually grow when you're resting, and I think it's the same thing.
Yeah, that's interesting. Yeah. It reminds me, when I was just talking to our mutual friend Randy, the other week, one of the things I took from the interview, like I posted this on Instagram, this quote where he basically said, people go to the office to hide from opportunity. It gets them away from everybody. I don't have an office. I never thought that I could have an office. And that stuck in my head, because it's like, it really is true, where it's like so many people just kind of go, often to an office, just their mundane kind of day-to-day life, and it's sort of, they want to be doing something different. Like they see people like going out and going on trips and to the beach and whatever it is, but instead of like pursuing their passion, they seem to just get kind of get locked into follow I think because it's easier. I don't know, it's like what they're used to, in part, kind of like what and there's like security in that, where kind of doing something like you do, like looking at yourself and trying to figure out these like very complicated issues, is something I think it's a lot easier like not to look at those. I think that's why a lot of people don't, they just go through their life kind of without really like thinking about like what am I, why am I here, what am I doing, what am I doing, what I want to be doing, am I doing what I'm doing because someone else or society has told me that I should be doing this. There's like all of these questions that I think, like, I don't know if they don't cross other people's minds, or they just don't choose to like engage them. I don't know.
It's like cleaning out a closet that like you've neglected for a really long time, and like it just has all this stuff in there, like you don't even know what's in there at this point, and that in order to clean it out, you have to open the door, and like all this stuff is going to come falling out, and like stuff that you haven't seen in forever, and you got to bring it all out into the light before you can throw away the stuff that you don't want. And you have to decide what you want to do with it. And you're going to like have to confront things like, oh, why did I buy that thing that I never used? Like, it's not it doesn't sound fun. It's kind of scary. And so you'd much rather just like leave that closet door closed and not open it. And society would love for you to do that as well, because you could just, keep doing your 9-to-5 job, make somebody else money, and and never really question who you are or try to evolve. Um, I mean, society is perfectly happy for us to keep doing that. And for many, that's fine because all they want is security. But I think that for people that want to break free of the past and be in control of their reality, they're going to have to confront what's in that closet. And
Well said.
and anytime you clean, anytime you organize, so like if I'm going to move stuff around my place and like clean up my room, it's going to look messier temporarily before it gets cleaner. And I think there's that inertia of like I don't want to see what's in there. I don't want to deal with that. And then there's also probably most people think that there's no point. They don't think that there's something more. They're like, this is as good as it gets. Why would I try to make it any better? And so if they don't
Right.
think there's anything better, then they're not going to try.
Right. Right. Yeah, if they think this is all there, and it's almost also like something I connect back to like where, like traveling and like if you're used to, living in, some rural town in New Mexico or something where there's, like one main street and, there you're in such like a confined little reality and maybe you don't have the financial resources or whatever to get out of that. And then you kind of just like that becomes like your worldview where it's like you think that's all there is and you think it's normal for people to like, just hang out and do whatever it is. But it's really I think that's what's cool about travel is it's like you get to see all of these alternatives of like ways to live. You see people living their lives in all sorts of different ways and you realize like, oh, I could be like this person, I could live like this, I could do, I could like kind of pave my own way based off kind of, picking and choosing what you see in different, whether it's different cultures or religions or, you know, just whatever it is, just kind of make like paving your own way.
Yeah.
I think that's, yeah, definitely important. Well, I want to, so this will wrap up part one of the episode. We're going to do a part two.